Alrighty, thank you, Matt. Now, as we've been reporting, Connecticut has confirmed its first case of measles in 4 years.
The Department of Health says the case involves an unvaccinated child under 10 in Fairfield County who recently traveled abroad and began showing symptoms.
Fox 61's Jamel Johnson is over at the University of Hartford with more details from the health department this morning. Jamel, what have you learned?
Yeah, Symphony and Brendan, Dr. Manisha Jutani couldn't really elaborate further as to what we already know about that measles case. What we do know is that it was a child under the age of 10 who traveled outside of the country and came back and started exhibiting signs of measles. Specifically, they had a cough, runny nose, congestion, fever, and a rash starting at the head. She couldn't confirm whether it was a boy or a girl. All she said was they were under the age of 10 years old. Now, they are conducting an internal investigation right now, basically trying to figure out where they went to when they went out the country, who they came in contact with outside of the country, and then when they came back in, who they came in contact with inside of Connecticut or any other place they may have went to. And once that investigation is finished, they'll contact those people and let them know that they came in contact with someone that had measles. Now, right now, Dr. Jutani said that around 98.5 kids in Connecticut right now are currently vaccinated for measles. And she said that really the biggest thing right now is to get vaccinated, get your kids vaccinated to have the best chance at preventing the disease. That is the number that they have for kids who are in kindergarten and up. She said that the people who are in homeschool, they don't have a specific number for them. And she said that that could be a way that a lot of parents might use homeschool as a way to maybe not vaccinate their kids because of them not being able to become in contact with other kids as well. So get your kids vaccinated is really her main point that she wanted to get across. Now, right now, we will have a lot more on this at 5, 6, and 7 tonight. But for now, in West Hartford, Jamel Johnson, Fox 61.
Thank you, Jamel. And to give us more insight, we've got Syed Hussain of Trinity Health in New England. Thank you for joining us. And
thank you for having me.
My first question is, how serious is it for kids that are unvaccinated to get measles?
Yeah, this is very serious. So let's talk a little bit about this case in particular. This is the first case in Connecticut in the last 4 years. So we've gone without a case for the last 4 years, but it comes on a backdrop of 1,900 confirmed measles cases per the CDC this calendar year alone, which makes 2025 the highest in over 30 years in the U.S., emanating from about 47 or so outbreaks. Now, in comparison, last year, 2024, we actually saw about 285 confirmed cases for the whole year from 16 outbreaks. So we've got work to do in terms of getting folks that are not vaccinated, children in particular, up to date in terms of their immunization schedule.
Yes. Now, Jamel just went into detail about the urge from our state health leaders to make sure children are vaccinated. So we know of this one case in Fairfield County, but at what point would this be considered an outbreak here in Connecticut?
So if there are more cases, contact tracing will be really important. I know the Department of Public Health is involved, and one thing they'll be looking at is, okay, so who was this child? Who was exposed to this child? Because remember, even 4 days before the onset of symptoms, a patient can transmit the virus, can spread the virus. It's 4 days before the onset of symptoms to 4 days after. So contact tracing will be really important to understand, okay, was there anybody who's not vaccinated, does not have immunity to measles, who was exposed to this individual? Because remember, if the answer to that question is yes, then they have a 6-day, very short time period to get the vaccine now to prevent measles from happening.
And going off of that, what symptoms should parents be on the lookout for then to make sure their kids are okay?
Yeah, great question. So it's fever, runny nose, runny eyes, and then of course the rash that can spread across the body. Now, children under the age of 5 or those individuals that are immunocompromised, pregnant women, these folks are more at risk for developing complications from measles, which can be either pneumonia or inflammation of the brain, which is encephalitis. Those are feared complications, and we can have death as a result of that. So it's really, really important that we take this seriously.
Okay, now for folks who have been vaccinated, received that vaccination as a child, is there any necessity rather to get a booster?
There is no booster. If you've completed the 2-dose, it's usually part of MMR, measles,
Okay.
mumps, and rubella. That's the combination vaccine. CDC recommends the vaccine to be given at 12 to 15 months of age, and then the second dose at 4 to 6 years. That time period can change. It could be variable, but the minimum duration required between the first and second doses is 28 days.
Okay.
But suffice to say, if you've completed the vaccine series, there is no booster required.
You know, it's good we're getting the message out right now, you know, for our viewers, but how else can we get the message out to this is a serious thing that we got to take serious?
Yeah, this is a multi-party effort in terms of not only the Department of Public Health, but also us in healthcare, our healthcare providers, and then using community organizations to spread awareness, trying to identify areas where there may be pockets of unvaccinated people, so we can, you know, answer their questions, dispel any, you know, notions of, you know, people have concerns related to the vaccine, and answer questions and get folks vaccinated.
Now, I want to jump back to some of those symptoms. A lot of those sound pretty similar to some respiratory illnesses going around right now with the runny nose and things like that. So at what point should a parent take their child to urgent care and think, like, this may be something else?
Right, great question. So if you've had recent travel, if you've been in an area which is experiencing high measles, either an outbreak or just a lot of measles prevalence, some of this child, for instance, had some international travel history, then you make sure you talk to your provider first before you actually take your child in.
Okay.
This is a very contagious disease. So 9 out of 10 people who come in contact with somebody who has measles and they've not been vaccinated or they don't have immunity will develop measles. So make sure before you decide on taking your child, if it's suspected measles, to either the doctor's office or an urgent care, make sure you talk to someone first so they can take appropriate precautions at that location.
All right.
Doctor, this is all very important information. We thank you so much for joining us this morning.
Thank you for having me.